Good afternoon, everyone, and welcome to our webinar, The Future of Healthcare Post-COVID-19. I'm Nitin Mehrotra, partner at KPMG, and I'm delighted to be your host this afternoon. Before we kick off, some housekeeping points. Today's webinar will run for approximately 60 minutes. We have divided the session in three parts. We start with an overview of the current changing trends in the healthcare sector, followed by getting insights from our panelists on how healthcare will change post-COVID-19, the role technology will play in the future of healthcare, and what changes we can expect from regulators and healthcare providers. And in the end, we have some time for questions from the audience. All participants will be on mute for the duration of the session, so please type your questions in the Q&A tab on the right-hand side of your screen. We will do our best to answer as many questions as possible. This session is being recorded, and you will receive the recording via email within 48 hours. After the session ends, you will be prompted to complete a short survey. Please take a few minutes to share your thoughts with us. At this stage, let me introduce the other panelists for this session. We are delighted to have with us Dr. Ithasam Al-Bastigi, Director, Investment and Public-Private Partnership, Dubai Health Authority. Dr. Ithasam has over 20 years of healthcare experience and is responsible for the development of various healthcare projects within the Emirates of Dubai. Before joining DHA, Dr. Ithasam was heading the Health Strategy and Performance team at the Prime Minister's office. We are also very pleased to have David Hadley, CEO, Mediclinic Middle East, which is owned by Mediclinic International and is one of the world's leading private hospital groups. David was worked for Mediclinic International since 1993 and was seconded to Dubai in 2007 to complete the Mediclinic City Hospital project. Since then, David has made Dubai his home and has spearheaded several projects for Mediclinic, including Al Noor's Hospital's acquisition in 2015. UK is Dr. Neeti Pal, Global Medical Director in KPMG Global Health Practice. Dr. Neeti is a clinical practicing doctor and has worked for NHS in UK and Bupa, helping them set up clinics in Saudi Arabia. Dr. Neeti is a board member of Diabetes UK, President-elect of the International Diabetic Federation Europe, and board member of Birmingham Women's and Children's NHS Foundation Trust. And last but not least, we have Richard Stolz. Richard is an associate director in KPMG UAE's Global Strategy Group and has been involved in a number of large healthcare projects for KPMG. He also co-leads the healthcare practice for KPMG Law Gulf. The last few months have been extremely challenging for all of us, and who would have thought in the beginning of the year that the whole world would come to a standstill? There is so much fear and uncertainty around us. We all are anxious about the health and well-being of our families, friends, and colleagues. And in these difficult times, world over, the healthcare workers have been on the front line, battling the crisis selflessly and also emerging as the true heroes. Needless to say that businesses around the globe have been severely impacted due to COVID-19, some more than others. The future outlook for some sectors is expected to change forever, and healthcare being one of them. We will talk to us shortly about the impact of current changing trends in the healthcare sector post-COVID-19. But before he starts, I would request KPMG Lower Gulf Chairman and CEO Nadir Hafar, who's also attending the webinar, to say a few words. Nadir?
Thank you, Nitin. I keep looking at the numbers of participants, and they keep increasing by the second. So I think we are good for about 164 right now. We are anticipating close to about 300 to 400 people. But before I go ahead and start, I want to thank everyone who joined today, this webinar on the future of healthcare post-COVID-19. We have, as of right now, like I said, close to about 170 participants joining us with over possibly 100 doctors and registered nurses and over 30 healthcare C-suite executive. We have participants from various sectors, roles, directors in the healthcare, apart from attendees from government and financial sectors. And we're very grateful for your time to join in to this webinar, and we hope it will be worthwhile your time. I also want to welcome one more time Dr. Ibtisam Al-Bastaki for joining. Also, Mr. David. David, good to have you again and see you. And also Dr. Niti, our Global Medical Director of KPMG Health Practice. I'm my introduction fairly direct, and I just want to share the experience that KPMG have and the amount of investment that we have and knowledge and power that we have in the healthcare sector. We do have a huge network of close to about 4,500 practitioners between partners and staff. Since March 2020, our team worldwide been working closely with both clients and working together within the firm, building top solutions around digital platform for assessing patients, and also designing supply chain for PPE, and also to assist government in developing their healthcare programs. So this is something close to our heart, and we like to continue learning from you today through these discussions and your future participation, and hopefully we can continue to engage with you. But also, take a minute and say a word to the healthcare workers who have been the frontline heroes from day zero. We cannot thank them enough for their bravery and dedications during this difficult time. Again, thank you to all the participants. We've grown up to about close to 200, 185 right now. Thank you for giving us this opportunity, and I give it back to you, Nitin.
Thank you, Nader. Over to you, Richard, to talk about the current changing trends in the healthcare sector post-COVID-19. Richard?
Yes, thank you very much, Nitin, for the introduction. In my part of the presentation, I will focus on the changing healthcare trends coming out of COVID-19, and I will outline 5 key related themes that we believe will affect the healthcare sector. If we can go to the next slide. So what we've seen is that health systems follow a similar path in managing the pandemic globally, which is centered mainly around 4 phases, namely the preparation and containment phase, which is related to first travel restrictions and event restrictions. The second phase led to mitigating the peak of the outbreak and enforcing lockdowns. That's where we've seen the partial closure of public places to full lockdown of schools and universities. At the moment, we are moving into the recovery and relapse phase, which is related to 12 to 18 months. And here we see the partial lifting of restrictions. And the question is how long we're going to be in that phase. Experts argue it could be 12 to 18 months, but it could possibly be longer. And finally, there will be the new reality, which will bring us to back as business as usual. And this might be expected to be at the end of 2021 or possibly later. If I can move to the next slide. So the voice of the healthcare sector. So what does the healthcare sector directly actually say? And I would like to quote external survey findings of leading healthcare executives interviewed in May. 5 key points have been mentioned here. 90% of healthcare executives predict revenues to be lower at the end of 2020 compared to pre-COVID levels. 50% of healthcare executives expect that it will take to the end of 2020 or possibly longer till elective surgery volumes will return back to pre-COVID-19 levels. 67% of telehealth of 67% of healthcare decision makers expect to use telehealth solutions at least 5 times stronger and 5 times more during and post-COVID-19 compared to pre-COVID times. And only 1/3 of these executives believe they have the right and sufficient telehealth solutions and technologies in place. And 1/3 of the executives believe that there will be increased M&A and consolidation activity happening post-COVID-19 in the healthcare sector. So this will lead me to 5 key themes that we believe are coming out of COVID-19 affecting the healthcare sector. Number one, the phased return of elective surgeries, the path back to normal. It will be key that essential and profound planning and prioritization will take place to bring back elective surgeries into the operation room. Some interesting statistics here, globally and regionally. Globally, we've seen that 28 million surgeries across the globe may be canceled during the key 12 weeks of the pandemic. Each week is causing an extra disruption of circa 2.4 million cancellations of elective surgeries, and this could lead to an overall backlog of roughly 45 weeks to recover. In the UAE, to put local context there as well, we've seen declines of 60 to 70% of outpatient visits, as well as elective surgeries during the peak time of the pandemic in hospitals. There are certain key considerations that are important for the healthcare sector and the path back to recovery. One is to reduce the wait list in an effective and cautious manner, but what will be key for hospitals is operational readiness. And this is related to workforce planning effectively, is also related to the temporary expansion of workforce when the operations elective surgeries come back into the hospitals. One key point will be the effective procurement of medical equipment and consumables. And lastly, but not least, we have to make sure that all the operations and all the procedures are still adhering to COVID-19 infection controls. If we can move to the next section. Another point that will come out is that governments will focus more on healthcare spend. Governments will increasingly realize the importance and the value the healthcare sector brings in. But some statistics first. In 2020, global healthcare spend is expected to decline. The downturn of elective surgeries caused by COVID-19 led to a sharp drop in spending. However, a strong recovery is expected for 2021. In particular, there will be a strong bounce back effect of people regaining trust in the healthcare sector and going back to hospitals. Some interesting statistics are here when we look into the UK. The NHS waitlist for elective surgeries in February has been 4.4 million, and this is expected to increase to 7.2 million in September. So we see a huge backlog coming up. Further, spend buckets that will be increasing is the expected spend on healthcare infrastructure, on vaccines, on R&D, and also, most important, on workforce to attract and retain healthcare talent and healthcare workforce professionals. Looking into the UAE, we've seen that the UAE government announced to raise its healthcare budget as well for healthcare spend in 2020 and 21. And accordingly, there will be continued investments in testing capacity, vaccines, digitalization of health services, as well as technology. If we can go to the next section. One of the key modes that will come out of COVID-19 will be the increased use of digitalization and telehealth. New modes of care will certainly emerge, what we call as the digital front door. Telehealth has the potential to revolutionize the healthcare sector. It allows practitioners to diagnose and treat isolated patients while saving time and money. 88% of patients that use telehealth for the first time indicate they would use it again. And when we look into the UAE, we can also see here that certain private players embarked on the journey of telehealth solutions. In the last recent weeks, private entities as Mediclinic, Asta, Al-Zara started implementing telehealth solutions as well here locally. And looking wider afield, we can see that 85%, for instance, in the UK, 85% of the UK's primary care consultations started happening remotely initially, which is also a great sign of telehealth becoming more and more important. If you can move on to the next section here, the focus on primary care and specialist daycare centers, specialist healthcare at your doorstep. Certainly, COVID-19 has been changing the attitude, expectation, and sentiment for patients accessing healthcare services. Patients have less comfort stepping into hospitals and spending substantial amounts of time in hospitals. Now patients have an increased preference for primary care centers and specialized daycare centers in close proximity to their home. And there are certain benefits of a robust primary care system, such as primary care provides a sense of social care as care is provided closer to communities and closer to homes. Primary care enhances a gatekeeper model as an entry point into the country's healthcare network for referral system towards secondary and tertiary care. And finally, also primary care enables preventive screenings on a continuous basis to limit the spread of lifestyle and chronic diseases. Also, in times of COVID-19, we've seen where the primary care element tremendously helped healthcare systems, for instance, in Europe, in UK, and Germany. In times of COVID-19, we've seen that solid primary care systems help prevent large hospitals from getting overutilized by COVID-19 cases. And also, we've seen that substantial volumes of COVID-19 patients were directly treated in outpatient clinics, easing the burden in large hospitals. Putting some local context here, Primary care is also a key priority of DHA, because DHA announced in its clinical services capacity plan for 2018 and 30 that it will be a key pillar in that strategy going forward as well. If I may move to the next section here. So what we also see is the likelihood of increased M&A and consolidation activity post-COVID-19. And this will be certainly growth opportunities, in particular for larger healthcare entities. To put this now in the general context, while COVID-19 is initially limiting M&A activity, it is likely to be a key driver for consolidation and M&A activity going forward in the future. COVID-19 will have key impacts, in particular on smaller healthcare entities, such as liquidity shortages and increased need for working capital. But these smaller entities, they might increasingly consider to team up with larger firms to regain financial strength and sustainability. Accordingly, the post-COVID-19 healthcare market will be dominated by sellers. And larger healthcare entities, particularly private ones, might have a stronger appetite for inorganic growth modes through M&A. To put this into the local context here, so we expect that M&A activity in the GCC is going to increase post-COVID-19, including different sectors, including the healthcare sector. And in the beginning of 2020, we've seen a decline in healthcare M&A activity, but going forward, a strong rebound will be affected and will be happening certainly in the healthcare sector as well. This has been the key part for my trends and themes, and I will hand over back now to Nitin.
Thank you, Richard, for your insights. And it seems that the healthcare landscape seems to be changing post-COVID-19. A lot of people believe that the impact of what is happening today will have long-lasting implications on the healthcare sector, on how will technology play a role in the future of healthcare, on how we will connect and engage with healthcare service providers, and also on how an effective healthcare system promotes purpose and performance for our societies. So in our panel discussion now, we will get into a little more detail into some of the trends that Richard has just highlighted. Please post your questions. We will, towards the end of the webinar, direct these questions to our panelists. So please keep them coming. I will now like to invite our panelists for the discussion, Dr. Issam, David, and Dr. Neeti. Thank you once again for kindly agreeing to be a part of this webinar. Dr. Issam, if I could start with you and talking about the new normal. So what does the new normal for healthcare look like, and what can healthcare regulators and providers do today to prepare for businesses for life after COVID?
Okay, thank you very much for inviting me to be part of this panel, and I would like to thank UAE government for the tremendous job that they have done in facing the COVID-19 as not only the healthcare sector, but including all the stakeholders, including private sector and all the volunteers who did a great jobs in bringing those numbers down by increasing the recovery as well. Of course, thinking of going back to the normal, what we used to do before, I don't think so this will be the case. We will go back to the normal, but it's really will be a different normal. If you look at the investment guide, which we have launched in 2018, we basically spoke and we have addressed it very well in regards to the capacity planning. And of course, these numbers might be changed with the COVID-19, but the way we have projected and anticipated for the specialities that need to be focused in the next 2 to 3 years and 3 to 5 years, these are those specialities needs to be accelerated for the future. And I think it will be really great opportunities for a lot of people and to look at them. And honestly, with post-COVID-19, it has been, I mean, we need to accelerate those specialty, and especially the one, even you have addressed it in your presentation, Richard had addressed it in presentation, primary healthcare, innovative primary healthcare, daycare surgeries, polyclinic, some other specialized services like center of excellence. These are the one really needs to that we need to look at them post COVID-19. And of course, we as an investment department, we worked on the certificate of need, and this really need to take a good care post COVID-19 to allow the specialities that we required for the community and as per the demand, and to avoid any duplication of services or any unwanted services which might not need it in the near future. So this is, well, basically, I'm just looking at it, how things will look like post-COVID-19.
Dr. Issam, David, if I can bring you in at this point, and Dr. Issam spoke about the new normal being a different normal. So if we were to talk about the path back to normal from an operational perspective, so what is a large healthcare provider like Mediclinic doing to bring back elective surgeries in terms of reducing the waiting list and prioritizing surgeries with heightened infection control requirements?
Nitin, and thank you to all the participants in the panel for allowing me to be part of this forum. And like Dr. Ibtisam said, I'd also like to congratulate the regulators, the country at large, in terms of the way they led us in managing this pandemic, and also to thank and congratulate all the frontline workers, many of whom were within Mediclinic. I'm very proud of what they've achieved and the results that the country has achieved in terms of the healthcare outcomes during this pandemic. It's been wonderful. So well done to them all. In terms of the new path, the new normal, as Dr. Ibtisam just called it, well, yes, for sure, things are going to change. I think, you know, a lot of the initiatives that have come into play, such as telehealth and digitalization, etc., they're not new, actually. They're just new to the region. They've been around for many years. And I think when the pandemic hit us, suddenly this type of technologies were introduced more rapidly than perhaps the incentives had allowed previously. So most of the providers jumped onto this new technology, and it allowed us to continue to treat patients. The one thing that has happened, and we talked earlier about the number of elective cases that have been delayed, if you will, is we've seen in countries like Switzerland, where we have a big presence, that more and more patients have been getting more ill at home, more strokes at home, cardiac disease at home, and this obviously has its challenges. So I think people are realizing that they still need to get their healthcare needs looked after. So whether it's through telehealth, through home care, through some form of a digital health application, people are going to be more aware of their healthcare needs, and as such will need to be treated. I personally believe that people are starting to become more comfortable with the fact that they need to wear PPEs, they need to wear a mask. You get trendy masks nowadays. Louis Vuitton even have some out. So there's some fancy new masks out there. So I think people are getting more accustomed to washing hands, to social distancing, and the way that the UAE has allowed the public or the economy to open up, where it's been gradual, has resulted in people being more cautious as they enter the marketplace. And the same is in healthcare. As you know, we've recently announced COVID-free facilities. City Hospital was first in Dubai, and now Parkview, and all of our Abu Dhabi and our AIM facilities are now COVID-free. And this was achieved through collaboration with the government, where they will ring fence COVID patients and allow non-COVID patients to go and to go to certain facilities where they've proven to the regulator that they can treat these patients safely. So I think the norm is already here. It's amongst us, and this is the way it's going to be for some time now. Testing will obviously be critical. Antibody testing, Niti, you mentioned this, is critical to opening the market up again. You want to be positive with an antibody test so that you know that you've had it and you're over it. And doctors generally believe that if you've had it, the chances of you getting it again and being sick are less. It's not proven, of course, but that's the general view on the street. So I think we're already in the new norm, and this is the way it's going to stay.
Thank you, David. And Dr. If I can bring you in at this point, I think Dr. Ibtisam did speak about X-rated primary health care. And we can see that COVID-19 is having a significant effect on patient behavior, wherein patients increasingly want to avoid visiting large hospitals and would prefer to visit specialized daycare centers and primary care outpatient clinics in close proximity to their communities. So what in your view are the likely changes in patient behavior that we can expect post-COVID?
Thank you very much. I'm delighted to be on this panel. and to be with colleagues like Dr. Ibtisam and David. Really lovely to be here today. So being a primary care doctor, what a great question to ask me. I've always said this, primary care gatekeeping, where there is, in countries where there's primary care gatekeeping, cost of care is lower. We know that Dr. Ibtisam, I'm sure, agrees with me. We've had many a dialogue on this, Dr. Ibtisam, and I think many health systems are starting to get to terms with this. So what we're also seeing is patient behavior is shifting in many countries. It is the only door to healthcare. Digital front ends are the only front doors to healthcare because people are terrified of going to hospital. I think David pointed out, and in countries that are opening up, there's gradually starting to return. However, people have got used to this way of interacting with their health systems. That's one. Two, you're quite right. Finally, I always say, don't waste a good crisis or don't waste a good emergency. So we've seen that as patient behavior shifts towards primary care, I think health systems and governments have a responsibility here to actually facilitate that and make it easier for that to happen. And I think that's kind of what I think you're going to want to see in the UAE and other countries where a lot of, and the UK actually, systems are very hospital centered and hospital centered for a reason. So I think if you don't actually allow and incentivize that shift as well, where patients are now going to do this, is going to happen, that shift is going to happen. I think governments and health systems are also going to have to change payment mechanisms. They're going to have to change how patients interact, how integrated care is put together, how value-based care is put together around the patient rather than anywhere else. And then finally, I was very interestingly on a very interesting webinar last week with the pharmaceutical industry across Europe and many patient organizations. It's called FPA, and we were talking about when two pandemics collide. And this was the diabetes and chronic disease pandemic, which has been around for a while. And we do know that people with diabetes are 30% more likely to die of COVID-related infections and death from COVID. And then you've got the pandemic that's hit us. And this is not the first one. I think many more will happen. And years to come, we just weren't prepared for this one. So when those two collide, I think cracks in healthcare systems start to get exposed. The pre-cracks in healthcare systems, they become deeper because health inequality is getting exposed, how people access care becomes exposed. So I think patient behaviors will define what happens in the future. But I do think that health systems have a huge role to play in this.
Thank you, Dr. Neeti, and I think David, as well as you, implied that things like telehealth, remote monitoring, and consultation solutions have been around for some time, but will expected to get significantly accelerated due to COVID. So, Dr. Ibtisam, if I can bring you in at this point, and if you could briefly talk about what can UAE healthcare regulators do to ensure that these new methods of consultation are efficient and add value to patients without compromising the quality of healthcare?
Of course, honestly speaking, telehealth was there, as even David mentioned, since long time. Maybe it is quite new to UAE, but it was, I mean, there were companies were existing in Dubai and in UAE managing telehealth and care for the, as a kind of like doing the role of the general practitioners. However, there is no ittisalat without TRA. So you really need to have a strong policy to build up around this kind of, service. So if you provide the telehealth services to the patients, I think it's one of the opportunity came out of the COVID-19 where we really need to focus on. And if we can take it into segmented different categories and apply it across the board. And I think it's telemedicine will be the new future of the healthcare, but if it's being regulated properly to ensure the patient rights, and of course, to have a proper liabilities even to the professionals. And we are talking something like face-to-face. I'm not talking about conversations between the patient, because you don't know that's been going on. However, like a teleconference, if I'm sitting in the room with my patients or using the laptop or iPad, it's similarly as he is going to visit me in my clinic. For instance. However, using this, we will bring kind of a lean concept into the healthcare system and into the operation, which is more efficient and cost effective. But as I mentioned, if you don't have a proper policy to protect both entities from patients, providers, as well as the payers, that's not going to work. So these are the triangle where you need to have them all together.
Thank you, Dr. Issam. If you can just change the topic of our discussion, and David, if I can bring you in and briefly talk about the M&A and consolidation in healthcare. And this is something that we've seen over the years, that there's increased consolidation and M&A activity in the healthcare sector. In your view, do you think that post-COVID, the consolidation and M&A activity in the healthcare sector is going to increase, as we are witnessing in places like Europe and Northern America?
I think the consolidation in healthcare has been happening for some time now. But because of this pandemic, the smaller operators and if you like, the corner clinics, etc., will be under more financial pressure, I assume, and therefore the opportunity to acquire these smaller operators by the bigger groups exists, and I expect there to be some M&A activity, especially in the UAE, and more consolidation, because there is room for consolidation in this market. It won't only happen on the provider side. I think we'll see it in other, in other parts of healthcare as well. You will see it on the medical insurance side. You'll see it on the supplier side. So there'll definitely be more consolidation in the industry, and I think that all bodes well for the patient, because from my perspective, it will reduce the cost and increase the quality. So in effect, the patient will get increased value for that because of the situation.
David, Dr. Neeti, you've heard Dr. Ittisam's viewpoints. You've heard David say about M&A activity and consolidation and the changes that, as a private healthcare player, they need to bring about in their business. For someone in your position, I mean, what do you think that governments, healthcare regulators, and providers need to do to rebuild best-in-class healthcare services? I'm sure you speak to a lot of them, whether they're regulators, whether they are private players, or whether they are small operators. So what, in your view, is going to rebuild the best-in-class healthcare system?
So I think I touched on that in my last kind of response on really putting the patient at the center of all of this. So really starting to think about what patients and your customers, your consumers of healthcare really want now. And they do want something else. They do want digital technology. They want payment mechanisms by which they can pay for stuff online. They want a different kind of experience, a different customer experience. So across the world, I'm working with a very large payer, a very large insurer, and we've launched 8 virtual COVID clinics across 8 countries with a very interesting online offline play. So I think what you also find is not just, and I think David will back me on this one, the online really is very important, but how the online and offline come together and how they meet each other is going to be really, really important. So how the systems come together is going to be important. And the government and regulators have a big role to play in this. So for example, there were many things that were not paid for in the past. So if you did a video consult, the payers wouldn't pay for it, including insurers and regulators. Primary care visits were not paid for. Probably that's considered the role of the government. So in many, many countries, that's the case where UHC systems are not in as big play as in some of the European socialized systems. But we do find that the government's going to have to come together on that one. Number 2, I think if you're really talking about integrating care around a patient, and really making that customer, the patient experience better. And the new millennials, the younger folks, are going to want a different experience. When you want that, the payment mechanisms are going to have to shift. So what are you going to pay for? Is it going to value? What kind of value are you paying for? Are you paying for value-based care on simply just on how many hips and knees and what your discharge outcomes were? Or are you paying for quality of life? Are you paying for a fact that if somebody has an cataract operation now, they can see? So, you know, that's the kind of thing that you're trying to look for. What is the quality of life? And also the patient experience in all of this, that value that patients' voices are going to bring to the table, to integrate healthcare systems and to understand what value. I'll give you a tiny little example, Nitin. My son has type 1 diabetes, and which is why I kind of advocate in the diabetes world quite a lot. There's a movement in diabetes. It's called We're Not Waiting. The hashtag is We're Not Waiting. And this is a group, it's the Open APS, Open Looping Community. And there's about 600 odd people across Europe that have created their own artificial closed loop pancreas. This is patients who've done it. They've joined their pumps to their continuous glucose monitoring system. So this is the kind of innovation that you're seeing coming out from patient communities who are not going to wait for drug device manufacturers or for health systems or for providers to meet their demands. They're going to go away and do it themselves. And that's going to be a very disruptive element in how this happens. Therefore, I think healthcare systems as well as providers are going to have to find a way of meeting these challenges quite innovatively. Otherwise, somebody else will come and disrupt them. And we see that with Tencent. I've been working a bit with Tencent Trusted Doctor at Ping An in China. And you're seeing that happen there. They were the first ones to bring out an insurance for COVID, for example. Didn't happen anywhere else. And in the UAE, I was working with this provider to look at how you bring out COVID insurance for a critical illness cover alongside a virtual COVID clinic for migrant workers who were stuck in through a remittance provider. So many new different ways of both payment and provision are starting to happen across the world. And if healthcare systems and providers don't respond to them, they'll find themselves being disrupted.
Thank you, Dr. Neeti. So David, Neeti spoke about a lot of changes that are going to happen in the healthcare sector, and the private operators, government, regulators would need to keep pace with all these changes. So just specifically talking about the changes that Mediclinic is having to make, considering COVID-19 will remain with us for some time to come. What changes Mediclinic is having to make to increase patient engagement, maintain patient trust and loyalty, and give them the assurance that healthcare facilities are safe for visiting?
So Nitin, I think first of all, there was some excellent points made there by Dr. Neeti on how healthcare is going to change and how it needs to evolve. And we obviously want to be part of that, and we support that, because at the end of the day, the patient needs to be given the care in the right setting. And to find out what the right setting is, it's important you understand all the settings available. So home monitoring, telemedicine, home care, primary care clinics, hospitals, rehab. So if you look at the continuum of care, it's quite vast. So it's quite important that from Mediclinic's perspective, that we're represented across the continuum of care, and therefore we can have the ability to send the patient to the right setting or provide the right setting for the patient, depending on their needs. And that in itself will create opportunities to look at new funding models, population health capitation and the likes, obviously assist funders in managing their risk, and also enable providers to reduce the cost. So I think Mediclinic is well positioned as we speak. We're in telemedicine, we're in home medicine, home care, we do home deliveries, we've got a lot of testing abilities. We have an EHR that's being rolled out, because you need the digital backbone to be able to interface to all of these applications, which is also critical. And we're also in an environment where the government is very supportive of innovative ways and is looking at the newest and the best ways to manage the population. So I think we're very well positioned across the continuum of care. And those areas that we're not well positioned, we're certainly considering how to get into those areas. And then more importantly, how to manage the patient across the continuum of care, which is critical to the success going forward. So I'm quite confident that we will actually come out of this stronger in the short to medium term.
Thank you, David. Maybe we have time for one last panel question. And Dr. Itisamam, if I can bring you in at this point, and you head the public-private partnership division within Dubai. healthcare authority, and we can't let you go without telling us that do you think that COVID-19 is an enabler for further stimulating public-private partnership in the UAE healthcare sector, considering that the public and the private sector have worked very, very closely right through this COVID-19 crisis to deal and treat patients?
Yeah, Nitin, honestly speaking, again, I would say that there were a couple of great opportunity came out of this COVID-19. I mean, there was a lot of negativity, but I was looking at it from the positive perspective. So it's like telehealth was one element. The other one is the public-private partnership. I think this is the right time where the investments needs to be done through the PPP projects. Honestly surprising, and you know Dubai, how it's very innovative city and how they can take a lot of risk as well. During the COVID-19, I got a positive response from the government by taking taking the projects of the PPP Cardiology Center of Excellence, to revive it again during such a critical situation. So that's mean there is a huge interest from the government to go towards the PPP projects, and that's actually a win-win situation for both parties, for public and the private sectors, and especially post COVID-19, we are mainly focusing on a specialty that really require like innovative primary healthcare, specialized center of excellence, polyclinic. There are lots of services that public and private sector, they can complement each others. And people who are really interested to understand more about the PPP law, they can visit the Department of Finance website, where they can find a lot of guidelines and policies of the PPP Dubai government's law around that. So, so we have projects going on, and there will be hopefully many projects of the PPP in the pipeline.
So thank you all for your engaging discussion. It was really insightful to hear some of your thoughts and how current events are shaping the future of healthcare, and also on how healthcare providers are responding to these challenging times. I think we are moving on to the last segment of our webinar. So I will now open the virtual floor to questions from the audience. If not already done, please write down your questions on the right-hand Q&A tab on your screens. We already have a number of questions posted, so Richard would start picking up these questions and direct them to the panelists. So Dr. Ittesam, David, and Dr. Neeti, if I can please request you to come back on your screens and pick up these questions that the people attending the webinar have for you. Richard?
Yeah, thank you very much, Nadine. Thank you very much to all panelists for sharing the insights and views. That's certainly very interesting. We've seen lots of questions coming through, mainly around the adoption of remote technology, of telehealth, of remote consultations. So I clubbed a couple of questions together here. And I would like to address the first question to David. And the question is, how can the clinics and hospitals using the emerging technologies and digital tools increase consumer adoption and maintain trust to sustain this new operating model?
I think it's, I mean, first of all, it's about the platform that you use. You can't just have a video camera and expect it to work, and there you go, you've got telemedicine. It needs to interface with applications that give the patient value. So they need to be able to see that having a teleconsultation actually adds value and is worthwhile doing. And there's a lot of benefits to doing it digitally, because you can interface with applications and give the patients real-time feedback, and interface with the patient portal as an example. I think one of the things that we have seen with the telemedicine is it also allows people to get the confidence to come back and see a doctor when they need to. And we have seen that quite a bit with our telemedicine that we run at the moment. Is patients are seen by the doctor on telemedicine, and this gives them confidence to be able to come back into the facilities once the doctor reassures them that there's proper protective equipment around, etc. So it's telemedicine we're just starting to explore, but there's so many opportunities there, and I think the patient will see that this adds value and creates efficiency in the healthcare system. And I also agree that it's here to stay. Whether it's 5 times more, I'm not sure, but it's certainly here to stay.
Thank you very much, David, for sharing your views here. We can certainly see there's a lot of excitement about telehealth. A lot of people ask questions, and it's something that will be staying going forward, as you had mentioned. One more question is related to the adoption of telehealth, and I would like to address this question to Dr. Ibtisam. The question is the following. How do you see the licensing of clinicians will develop or change given the move to a more telehealth-based medicine? For instance, when a specialist, a healthcare practitioner from the UK, would provide teleconsultation in Dubai, how would you see the regulatory framework and the licensing is going to be affected by such circumstance?
Okay, it's a very valid question, and DHA's regulation team, they are working around this issues being more than a year. Because at the moment, the way they are licensing the telehealth consultation as any other normal clinic. So, you know, they should have, it's not only a platform company where they are providing the technology services. It's basically you need to provide even the backbone from the physicians and licensing them, whether they are GP or family physicians or any other specialists as well. But what I can see that most of these platforms, it should integrate between the primary healthcare clinics or polyclinics and the secondary and tertiary care providers. So therefore, there will be kind of a seam line between all these providers, and patients will know where to go. And if you look at it even from the payer, it will be more cost effective rather than the patient ending up directly into the hospitals. Most of those cases can be managed through the clinics. So I think our regulation team at DHA is working around that, and having a secondary kind of consultations, whether from any part of the world here, this really you need to have a strong policies and regulations, because you need to ensure the medical, legal and ethical issues to the patient as well as to the provider and to the authority. So it's not just, it's a one way, it's actually both way that they really need to work together. I'm sure our regulation team with the legal team in DHA, they're working very closely to bring up this issues and accelerate it as much as possible, because this was one of the opportunity which came out post COVID-19, where they can ease the processes and bring the services towards the patient.
Thank you very much, Dr. Ibtisam, for elaborating on this. One more question I would like to address to Dr. Nitti. Dr. Nitti, you have tremendous experience in the telehealth field. How would you elaborate the point on data privacy and data security when it comes to providing telehealth solutions? Outline your thoughts.
Yeah, so interesting one, Richard, and thanks for asking me that one. You know, I've been hearing this for the last 17, 20 years, and my answer is always the same. 20 years ago in my practice in the UK, I started doing telephone consultations. I'm not talking about videos or digital, telephone consultations for my patients. And I got it in the neck from all my colleagues around me, and they all thought it was completely bonkers and mad. And also, and my colleagues who were not in my practice saying, the GMC is going to be on you, you can't do this, not allowed, blah, blah, blah. So all of those stories, and 20 years on, we're still having the same dialogue. And it's baffling to me. It's a little bit baffling to me. I do know that data privacy it's very important to the patient, but that's not beyond the wit of man. And it's what David alluded to. How do you get your digital infrastructure up and going in a manner that allows interfaces to happen, but also protects your patients? And if you ask a patient what they want, the patients say, well, I didn't know there was what's the data privacy issue when your doctor picks up the phone to talk to you about, you know, something else. So and there are many platforms that people are using anyway, encrypted platforms like WhatsApp, that patients are interested in using. They use that all the time in many countries around the world. So my answer to this is, the regulator has got to get a fresh look at this, look at it from a patient perspective, and really start to understand what they're talking about. Just saying data privacy and blocking everything and worrying about, oh dear, I can't deal with this, but actually thinking about what that is going to get really, really important from a patient perspective. So that would be my view. And I've launched telehealth services in numerous countries, or one of which has 7.8 million users using it now. And I don't call it telehealth, I call it digital health. And digital health is slightly different, I think, from just telehealth or video consultations. It's about that whole health ecosystem that you're building around a patient.
Actually, Niti, I really agree with you, because honestly, people here and my community, as well as my friends and my families, they've never been used to the telehealth, but since COVID-19, they loved it. And they say that's the easiest way that we can reach to our physician and deliver even our drugs to our home. So that was fantastic for them. And by the way, they're not thinking from the legal perspective, but we as a, being in the administrative role and in the strategic role, we think, beyond the aspect of the patients and how we can maintain the privacy of the patients and their, and their histories and, an examination and other stuff around them. So exactly, I agree with you.
And that's possible, right? You can maintain all of that and provide a great customer experience to the patient, to the consumer, and it's all the way through, right? So, Richard, a large part of what I found across the world, about 8 countries, while we were launching some of this, a lot of the companies that are doing digital medicine started off as content providers. And LTB, who is in your region, started off as a content provider. Babylon started off as a content provider. So all the largest, Tencent Trusted Doctor, Ping An, started off as a content provider. Almost all of the large ones started off as content providers. Ada Health, Medictor, I can talk to you about numbers of them. They started off like that. When they started off like that, the content was what was being offered. You weren't offering diagnosis, you were offering content, and that's how all of this kind of took off. And now they're interacting with consumers differently. And then the second bit I'm finding in the health ecosystem, Richard, is chatbots. So the biggest cost to healthcare is the cost of the doctor or the nurse. That's what, and David will tell you this, he does this for a living, is that it's the cost of the doctor that is the maximum cost to a healthcare provider. And these are in short supply. My boss has written a great book. Your boss has written a great book called Human. And we know that. So a whole bunch of interesting new devices are coming into play. And I'm working with about 6 or 7 of these chatbot companies. Ada Health is one, Medictor is another, K Health is another. So many of these are starting to put their front end in front of the patient. And often you don't know that you're talking to a bot. You're actually you think you're talking to a doctor, and they're coming out pretty accurate in terms of where they're navigating you. So the navigation function of where you go next, I think, is going to become really important, and providers are going to have to come to grips with how that navigation takes a new turn. How quite people monetize that is quite a different story.
That's certainly very interesting, and thanks for sharing these insights, Dr. Niti. And we see there's a lot of enthusiasm in the room, in the market. As David had mentioned, telehealth is here to stay, but there's still questions that have to be clarified on the usage, on data privacy, and these regulatory frameworks. So let's see how the coming months and years will evolve with telehealth. If I might move to another aspect out of the question that came up, which is more on the operational side of things post-COVID-19, I would like to address this question to David. And the question is the following: what changes can large hospitals expect in the long term in order to provide safety for patients who are vulnerable to COVID-19?
What was the last component of that sentence?
So let me just repeat the question. What changes can large hospitals expect in the long term in order to provide safety for patients who are vulnerable to COVID-19?
I think, well, first of all, I worked in a hospital in Southern Africa previously, and I remember when HIV/AIDS first came about, and it was suddenly everybody was terrified of HIV/AIDS, and eventually what the message was to all healthcare providers was, you need to treat every single patient as if they've got HIV/AIDS, and you need to have the protective equipment in place and the right PPEs, etc., to manage as if every patient had HIV/AIDS. And this is going to be the same now with COVID. Even though you're a COVID-free facility, there will be cases that come through the front door that could have COVID, that are suspected with COVID. So you need to ensure that your staff are protected, that you have the right social distancing measures in place when you come into facilities. We have these cameras that you come in and they do the heat map and the likes, and rows and exits and entrances that are separated, and you need to separate people in the pharmacy. So this is critical, and we'll be here for a while as we get to understand this virus more. But this is the way that all, I think, hospitals will manage the situation. They will have to treat each patient as if they have COVID. Obviously, those that do have COVID, you will take even more precautions to, especially when you do surgeries or the likes. And obviously, testing is critical. We will be doing testing of all patients before they go for surgery and all of those sort of processes.
Thank you. Thank you very much, David, for sharing your insights there. Much appreciated. Another question came through, and I would like to address this question to Dr. Nitti. And Nitti, the question: how do you think how do you think post-COVID-19, how will the post-COVID-19 situation affect the home nursing and the whole home care industry in the UAE, but also globally?
Very interesting question, Richard. Whoever asked that was spot on and pointing out that actually that's the next frontier. I think in healthcare, that's going to become very different. So one is that the huge crisis that happened in the UK, the hidden front that we saw was in UK care homes and in people's homes, where unfortunately we lost a lot of people because this wasn't paid, I think, attention to in the way that it should have done. So I think we're going, as the population ages and more people have chronic comorbidities, which is in the UAE a big problem. 1 in 4 people are going to have type 2 diabetes in about 10 years' time. So it's a very big number that we're talking about. The home care practice of what you put in the patient's home is going to become interesting, Richard. And it's not just about the PPE and looking after people safely at home, which is of course absolutely key to getting this bit of the service moving properly and to protecting both our frontline workers, our healthcare assistants and nursing assistants, and our patients. The second, I think, revolution that's coming here is the remote technologies really starting to become important now. And those remote technologies, I'm working with some very interesting companies right now who are using satellite-based technologies to, and the military use them all the time, is to create avatars almost like your virtual home care assistant. And this is ambient technology. You don't need to have a wearable, or you don't need to put a particular, you could have a flower vase, which is your ambient technology that allows this avatar to, and this might sound futuristic. Mayo Clinic in Cleveland, I don't know about Cleveland, Mayo are testing this in the US right now. So these are bedside assistants, or almost taking your temperature, seeing whether you fall, a whole bunch of stuff that then goes back to tell a doctor or a nurse or your caregiver to understand how you are at that moment in time. So I think some of these remote technologies are going to become really important. 2, I think looking after your chronic diseases better, and how patients are going to be encouraged to look after some of this better and how they're going to look after themselves better, is the second bit in the home world is going to become very important. And data analytics, and the biggest acquisition we saw last year, the biggest healthcare acquisition last year was with Roche and Flatiron. It was the biggest data analytics platform that was acquired last year, biggest amount of healthcare spend, massive amounts of money. So I think the analytics story, which, and the data story, which wasn't very clear to start off with, now is starting to become important to understand personalized medicine, home care and remote care, particularly around chronic diseases.
Thank you so much, Nitti, for elaborating on this. Very insightful, as always. I thank the panelists for sharing the interesting views and insights here. Also thank the audience for posing the questions and addressing these to us. Let me please hand over now to Nitin.
Thanks, Richard. And with this, we are now coming to the end of our allocated time. For me personally, the key takeaways from today's session have been that digitalization and telehealth will become the new models of care. Redesign of the healthcare system is needed to deliver resilient, patient-centered care. Innovation is required to meet the evolving demands of a health system, and increased public-private collaboration in healthcare is expected going forward. I would like to again thank Dr. Ibtisam, David, Dr. Nitti, and Richard for being part of today's session and making us all richer from their experiences. I'd also like to thank all the attendees for spending your time with us and for making it engaging with your questions. I do sincerely hope that you found this session a fruitful investment of your time. I look forward to connecting with you again soon. Please complete the short survey after the session. Thank you all and stay safe.
Thank you. Bye-bye.
Thank you.
Thank you. Bye-bye.